Welcome to Care of the High Risk Newborn Part 1. This will be an overview of some of the issues faced by these babies. Now here are a lot of very tiny babies. They're high risk because they're all preterm. Notice that they have nasal cannulas, NG tubes, orogastric tubes, high flow nasal cannulas, and eventually, with tender loving care, you see the baby in the middle, 119 days in the NICU, and he's finally getting to go home. And look at those little cheeks. This is a picture that you will find in your textbook, and it depicts what goes on externally in gestational development. So you can see that at 11 weeks gestation, that baby is tiny. At 26 weeks gestation, they're looking pretty good. Like, boy, that baby could come out and wouldn't have any problems. And then, of course, we get to the term baby, and he's really big. But the problem is less than 37 weeks, these babies may look like they're developed externally, but internally, they are not fully mature. Here's a baby that was born at 22 weeks gestation. She's tiny. She has no subcutaneous fat. Her skin is extremely thin, and her color is what we call ruddy because all of her vessels are so near the surface. She's intubated, and she's extremely tiny, sitting in somebody's hands. Look at the size of the diaper. It's way too big. She would be considered a micropreemie, and we actually have micropreemie diapers. So the neonatal period is a vulnerable time, and it doesn't matter if they are term or preterm. Perinatal risks, meaning what happened during the pregnancy, increases the vulnerability. The prenatal risks, how healthy was the mother when entering the pregnancy? What are the genetic factors that may have impacted this pregnancy that increases vulnerability? And then we have postnatal risks. How well did they transition from being in utero to being outside of the uterus? There is a slight variation in what we consider to be term. Some will say 37 to 42 weeks, while others will say 38 to 42 weeks. And prior to that term period, the infant is considered premature or preterm. And we have late preterm and then preterm. Put the video on hold so you can review the physiology that goes on in that neonatal period. The younger the baby is gestationally, the more problems they have. So if they don't have much in the way of subcutaneous tissue and subcutaneous fat, they are very vulnerable to poor thermoregulation. They do not have any brown fat to be able to generate heat. Their skin is thin. They lose fluid. Any motions that they do is purely reflexive. This is a picture of the Ballard Gestational Age Assessment Tool, and you'll notice that it has two parameters that we're looking at, neuromuscular as well as their physical maturity. What we do is the full Ballard assessment, and we'll check off what we're finding in the posture, in the square window. Are they recoiling their arm? What is the position of the baby when they're laying down? Does the baby have lanugo, which is the fine hair that is on the skin? The more mature they are, the less lanugo they have. Do they have breast buds? Can you even see the nipples? So the more premature they are, they're going to have a very flat, very small nipple. And then we'll look at their genitalia. We add up the score for each of these, and then we compare that to what gestational age is reported at the time of the baby's birth. And this gives us an idea of anticipating problems. And when you look at this baby, he looks like he's term. In fact, he might even be post-term, because if you look at his chest and you see how that skin is really dry and peeling, that's a sign of post-maturity. You can see the similar findings on that arm. The nurse is doing the square window test. The baby has nice chubby cheeks, and he's a no neck. You notice? You can't really see that neck. All you see is chin and a little wrinkle. So this baby is probably mature and shouldn't have any problems. This ends part 1, and now we're going to start going over the different problems that babies have when they enter the world.